there are two big reasons that you want to use the hip hinge, and there may be 5 things that you aren't doing properly. So let's get right to that. Hi there, and thanks so much for coming to my channel. For those of you who don't know me, I'm Marian Barnick, registered kinesiologist and functional movement specialist. I analyze how you move, find out what's not functioning properly by way of asymmetries, mobility issues, and we break those down, correct them with better body biomechanics so you decrease pain, improve function, and accelerate your performance. And what we're looking at today is the hip hinge. Now, this may be a move that you could have used during rehabilitation. It may be something that you heard of once upon a time and you've dismissed it. You've decided that it may not work for you. Maybe it was too simple. Maybe it was something that caused pain. But what I'm going to show you today is 5 things that you may be doing wrong biomechanically that really didn't bring about a better hip hinge, because the hip hinge is really important. There are 2 main factors that you really want to automate how you move in and out of the hip hinge. 2 big reasons. 1 is performance. 2 is pain. The hip hinge, when you use it properly, really helps you with your performance. We are talking about using those posterior muscles in the legs and the glutes to really generate power, which increases your speed and helps with your agility when you're on the court, on the field. Number 2 reason that you really want to make sure that you've got a better hip hinge is because it decreases pain. If you're not doing your hip hinge properly, it may exacerbate things such as low back pain. You may feel it in your hip flexors, and you may feel the tightness in your hamstrings, and it may change how you're performing. So I want to make sure that you are ready for the 5 things that you need to check to make sure you've got a better hip hinge and that you're doing it correctly. So first of all, let's talk about the hip hinge. The hip hinge is bending forward, only moving the pelvis. I know we call it hip hinge, but what we're doing is rotating the pelvis. We're not moving the spine. The spine stays in really nice alignment. And that's how we're going to check that, first of all, is to make sure that you're starting with neutral posture. So if you can't get into that neutral posture, then there's issues that we need to talk about with mobility. So first things first, check your posture. Make sure you have ear over shoulder, shoulder over hip, and make sure that your pelvis is in a neutral position. Now, if you're having problems with the pelvis, then I'm going to direct you to the video up here. I'll put the link below as well. We talked about pelvis positioning with sitting, but it's really important to look at those 3 factors that you can implement to help with the mobility of your pelvis and making sure you get it into a neutral position. So that's to start off with. I want to make sure that you're in a neutral position before we start the hip hinge. So problem number 1, whether or not you're using your spine instead of your hips. If you're in a position where you are bending forward with your back flexion instead of your pelvic rotation, then that is an issue where it's going to increase pain, and you're certainly not going to see any benefits from doing your hip hinge. Now, what's the reason for this? If you're bending your back instead of rotating your pelvis, chances are it's because of weakness in your core. And what's happened is possibly an injury, possibly something that has created the requirement for you to compensate. And it's automated. You don't even realize you're doing it. But what's happening that instead of rotating the pelvis, you're flexing your back. And of course, that's going to cause pain. So if you're automatically bending your spine, I want you to check for your core stability and check that your core can hold you with those positioning that you need to keep the spine aligned. The next thing I want you to take a look at is how far you're bending your knees. I don't mind you having some flexion in the knees as you go into the hip hinge, but it's something that has to remain stable, and it's something that shouldn't be more than, let's say, approximately 10 degrees. Now, I don't want you to take out a goniometer and measure that, but what we're talking about is a little bit of flexion in the knees and then all the movement through the pelvis. But if you find that you're really flexing the knees, I'm going to bet it's because of your hamstring tightness. The hamstrings cross two joints. One is attaching to the pelvis, so those hamstrings are going to be affected by how you rotate the pelvis. And the second joint that the hamstrings cover are the knees. So you may be bending your knees to try and compensate for some tightness in your hamstrings. So I want you to take a look at Monday Moves with Marian, where we review the hamstring flexibility and improving that, because I know that's going to make a huge difference for your hip hinge and the benefits that the hip hinge is going to bring to you. Then I want you to take a look at whether or not you really have your pelvis in that right position. If your pelvis is dropped back into a position where you've lost the curve in your low back, then your hamstrings are too tight for you to even get into that neutral positioning. Again, I want the pelvis to be neutral, so when you move through the hip hinge, all of that movement is coming with those posterior muscles, strengthening through the glutes and stretching through those hamstrings. So if you can't get into that neutral position, we need to start with mobility first prior to working on hip hinging. That's what I want you to look at if you've got your pelvis in a position that's decreasing the curve in your low back. Now, the opposite to that is too much of a curve in your low back. If your hinging actually isn't with the hips and that movement of the pelvis, and it's coming from really increased lordosis in the low back, then again, we're looking at an issue here with the core and stabilizing the spine. I want to make sure you can keep that spine in a proper position. So what I want you to do is use a dowel, use a stick, something that's very light and long enough where it can touch the back of your head, your mid-back in the thoracic spine, and then in the sacral area, right on your tush. So when you do that, I want that dowel to stay in position as you hip hinge. If you're increasing the lordosis in your low back, and if you are actually decreasing and dropping your pelvis, you'll see the change in your spinal alignment, which will mean that one of those points of contact is going to come off the dowel. So remember, I want the dowel touching the back of your head, the T-spine, and then the sacral area, and keep it in that position as you move through your hip hinge. That's going to make sure that you're using proper spinal alignment. Now, if you're finding that's a big problem, then we're going to refer to the other areas we talked about with the tightness in the hamstrings or core issues with stability and holding yourself with that posture. Now, one of the biomechanical issues that I see recommended by some, and I don't want you to try this, is the reaching forward with the arms as you hip hinge. What happens with the reach forward, if you have any trouble with stability or you have trouble with shoulder range of motion, and that includes how your scapulas move along the ribs, then what you may be doing is compensating with your thoracic spine. That's going to cause an issue with your hip hinge because you're actually going to lose the kyphosis, that nice curve in your mid-back as you reach forward. So make sure that you've got great stability with your scapula and good shoulder range of motion so you have proper motor control prior to reaching forward. So do your hip hinging without the reach first to make sure that you've got everything implemented properly. Now, a couple other points I want to make biomechanically that I want you to check when you're doing your hip hinge. First of all, as you are coming forward, keeping that spinal alignment means your eyes will be focused lower onto the ground and not forward. So if you are extending through the neck, that's putting a lot of strain in through the cervical vertebrae, and you may be getting pain in the neck or the upper traps while you're doing your hip hinges. So watch to make sure that your eyes are staying in level as your spine moves and you're not trying to jet out your chin to change the direction of the cervical spine because you're looking too far ahead and not actually where your spine is aligned. The other thing I want you to check is the positioning of your feet. I don't want duck feet, I don't want your hips rotated in, and I don't want a wide stance. I want you to make sure that your legs are coming straight down from your hips. If that's not happening, then it's going to cause alignment issues where you may compensate in using improper muscles, and you're not going to get the benefit in through the glutes and in through the hamstrings that you're really looking for and that a better hip hinge is going to bring. So that proper alignment with the body and your proper biomechanics with moving is what's going to make the difference of really tracking through the glutes and really working through the hamstrings as a unit. So check the alignment and make sure that you've got the proper positioning prior to starting that move. So I want you to try implementing those strategies with your hip hinge. I want you to improve that hip hinge so you can really automate that movement and automate using your posterior muscles. When we do that, then you're going to see that those glutes are firing better, they're giving other muscles a rest, and it's going to improve your performance and it's going to decrease your pain. So if you have any questions about that, please comment below. Let me know how the strategies are working for you. And if this is something where you'd like to dive a little deeper into the biomechanics of movement, if you have set goals with how you want to improve your alignment, improve your performance, and get better results, then get your name on the wait list for our technique training. These are online sessions that I hold with a small group of people, and we really make sure that your questions are answered and you understand the components of your body, the dysfunctions that may be occurring, and how to correct those biomechanics to get better function, improve your performance, and of course, decrease your pain. So I hope you guys have an awesome day and see you soon.